All righty. Good afternoon, everyone. I understand some of you are here locally, but many of you are out of state, even out of country. So welcome to East Meets West Parent Education Club. We are seriously beyond thrilled. We've been talking for the last few weeks about how delighted we are to have Dr. Cynthia Pan to be our speaker today. So before we move to her significant portion, just a few quick announcements from my end. And as many of you, and thank you so much, have been supportive of our club, you have probably also enjoyed our virtual gala, which was very successful. Our experience were able to help us to be able to really raise some funds. And our funds are now going to be distributed. So we have already gone through our board meeting, and here are some of our distribution that I am very happily going to be announcing to you now. 所以欢迎各位来到美中家长亲子教育协会。那么我们知道今天来参与的有很多是在本州加州，但是也很多是外州，甚至于是国外的。我们这几个礼拜都超兴奋的，因为我们这位潘医生他会带给我们很宝贝的资讯。但是在他还没有开始之前呢，我先来做一些就是我们最近一些活动上的报告。您有很多位呢都已经参加了我们这一次的筹款会哈，那么我们也的确是很成功的筹到款数了。所以我们现在呢，经过了我们的理事会，我们就会颁发以下的这一些给我们社区的学校以及社区里头其他的机构。So the following, we are making $5,000 to San Marino USD, which is the Unified School District, and $500 to San Marino High School for mental health. So a total of $5,500 to the San Marino schools. And then we are also providing $5,000 to the Arcadia USD, again, Unified School District, to help them to recover from the pandemic. We are also providing $2,000 to Bowers Museum, which is in Orange County, that has been very supportive of Asian culture exhibitions and has suffered greatly from the pandemic. We are also going to be providing $1,500 to LA Food Bank, which feeds a lot of the hungry people here in the LA area. We are also going to be supporting $1,000 to the Los Angeles County Arboretum, which many of you are very familiar if you live in this area near the San Marino Arcadia area. And they also have suffered because they had to close out all their indoor programs. We're also providing $1,000 to the Monrovia USD to help them to recover and open up the school. We are also discussing additional school districts to support, as well as additional community organizations to support. So I will be delighted to give you those updates as they are officially approved. 所以刚刚所讲的就是我们这个附近的学区，我们从1000到5500不等，就是看每一个学区他们的需要跟他们的大小。然后我们还会再继续的帮助我们的社区里头其他的机构，包括博物馆啦、植物园啦，我们都还是会继续的看看，还有其他更多的我们会再继续报告。那么我就现在讲一下呢，我们下一个礼拜就是4月3号星期六的时候呢，我们在圣马力诺这边呢，我们就会有一个很好玩的活动，是属于就是刚刚好是复活节的时段，然后呢，请小朋友一起来玩。那么还有一个就是我们5月2号也有一个活动，那么这个呢就是特别讲到我们最近1-2年来都是时常遭受到这个华人呢时常遭受到侵袭，而且亚洲人时常遭受到侵袭，所以我们会特别讲到这一段。So in addition to the ones that I have just announced, I would like to also announce that we have a couple of activities. So next Saturday, April 3rd, the San Marino Egg Hunt is a drive-through. So you can just go to Google and Google San Marino Egg Hunt, and you'll be able to get a map so you can enjoy egg hunting through the driving through for children 2 to 12, and it'll be very safe and very fun. And we will also have in our May event, a May 2nd event, where we will have a town hall meeting from 2 p.m. to probably 3:30 p.m., where we're going to talk about how the Asians, especially during this pandemic for the last couple of years, have really been basically aggressed against, a lot of aggressive behaviors, especially the most recent one in the massage places where he drove to those massage places to kill people. So we're just really, really hurt by all the things that are happening. So that is on May 2nd. So please note it down, and that will be a virtual event. So with that, I would like to now welcome our East Meets West Vice President, Mr. Isaac Huang. 所以现在请 Isaac 来介绍一下我们潘医生。
Thank you, Sophia. Dr. Cynthia Pan is an internal medicine, geriatric, and palliative care physician in Queens, New York. She's the founding director of the palliative care program at New York Presbyterian Queens, that is NYPQ. Since 2010, Dr. Pan's palliative care program has helped thousands of seriously ill patients and families since then. Under her leadership, the NYPQ palliative care team is fully interdisciplinary with physicians, nurse practitioners, social workers, pharmacists, and chaplain. The program trains palliative care physicians for the future, and it teaches countless doctors, nurses, and other healthcare professionals on principles and practice of palliative care. Dr. Pan strongly believes in interdisciplinary education and has a grant to provide small group communication training focusing on clinical communication and advanced directives using standardized patient actors. She is working with 27 nursing homes in Queens to build frontline capacity for palliative care in nursing homes. And during the COVID-19 pandemic, Dr. Pan disseminated basic palliative care tools to frontline caretakers to help their care of the seriously ill patients. She educated the medical and public community by sharing her personal experiences being ill with COVID-19 and lessons learned. We're also grateful to have Dr. Pan's two sons participating in this talk today. We hope to learn from the Pan family how their family dynamic helped them through the good and the bad time. So it is my distinct pleasure to introduce Dr. Cynthia Pan and her two sons, Christopher Sandell and CJ Sandell.
Thank you so much, Isaac. Thank you to Sophia and Annie and everyone for coordinating this talk. It's our honor to participate and to speak with everyone. So right now I'm going to share my screen. Okay. I hope can everybody see?
Yes.
All right.
Yes, perfect.
So I don't have any financial disclosures. NYP Queens.
Yeah, we are starting our YouTube broadcasting at this point.
Okay.
Everything's
Okay.
All right.
Okay.
NYP Queens.
But yes. Hello, Eileen. So Eileen is the event chair. Do you see Dr. Pan there?
Hello, hi, Eileen.
Oh, hi.
Hi.
Are you skiing, Eileen?
Yes.
And Dr. Pan, if you ever have a chance to come to LA, you must tell me, okay? I love to play.
Wonderful. Should I keep going?
Yes, please. Yeah.
Okay. So I don't have any financial disclosures. I do want to say I'm very honored and grateful to the East Meets West Parent Education Club for the opportunity to speak and meet everyone. I think it's wonderful that you're doing so many meaningful activities for your families and the community. So thank you. So just a little bit about my background. I was born in Taiwan. I went to school there until 3rd grade. And then we moved to South America until 7th grade. And then we moved to the US when I was in 7th grade. So I'm able to speak Mandarin, Spanish, and English, which is very helpful working in Queens now in New York. Every day when I see patients in the hospital, I can speak English, Spanish, and Mandarin, and it's a lot of fun. So I went to college at Harvard University, and I trained in medical school and residency in New York at Stony Brook and Rochester universities. I've worked in different settings, including inpatient hospital, outpatient clinics, nursing homes, home hospice settings. And like Isaac was saying, I'm directing the geriatrics and palliative care program at NYP Queens. I'm also the director for their graduate medical education programs, training residents and fellows for the future. So I'm very passionate about having meaningful conversations, especially working in palliative care and seeing patients who have serious illnesses. It has taught me that life can be short and we need to make the most of it. And definitely that had happened in COVID as well. We saw so many people die, having a lot of symptoms, and not able to be with their families because of limited visitation policies during the time so that people don't get infected. And it was a very difficult time. So some of the things that we're going to be talking about is how can we deal with our family relationships if we've been infected by COVID-19, and I'll share my personal experiences, and my sons will share their perspectives as well. And talk a little bit about using my palliative care skills, which taught me the ABCs about how to survive things like these. We're going to talk a little bit about the vaccines that are out there, the 3 main ones that are available. A lot of people have questions about, should I take the vaccine? Should I not take the vaccine? I would say take it. If you have a chance to take it, but I'll give you more information in a little bit. Also, how about handling our kids returning to school? My kids have a lot to say about that, so you hear from them. Some of the long-term sequelae of COVID-19. Now it has an official name. It's called PASC, which stands for Post-Acute Sequelae of SARS-CoV-19. And the fact that we're coping with 3 pandemics, a little bit more about that, and ending with the 4 things that matter most in life. So the story that I want to tell starts back in February of 2020, when life was still normal. And we actually, as a family, went to ski in France. We were in Val d'Isere. So Eileen, we're both skiers. And it was beautiful there. And there was some news that, this, virus is in Wuhan, and then it was in Italy, but it was still far away. We weren't sure how far it was going to come. And thank goodness we were having a good time in Val d'Isere. And then when I returned to the hospital in March, I was working, and then one day on March 19th, I left the hospital at night, and I saw that outside of the emergency department, they had built these tents because the hospital was already, every time I see these pictures, I get a little emotional. So, excuse me. And because the whole hospital was full, the whole emergency room was full, and the hospital built these tents to start screening and checking temperatures of patients and just doing COVID screening. And then a couple days later, I came into work, and my unit on the 6th floor was now shut down to regular personnel or visitors because it now became a COVID unit. And basically every couple of days, we converted 2 more units into COVID unit. And at the height of it, we had 93% of our hospital was COVID patients. So definitely during that time, it brought a lot of emotions. At first, it was fear, anxiety. Nobody knew what to expect. A lot of uncertainty because nobody had faced this before. Some people were angry. But most of all, what I saw was courage, um, because everybody banded together, everybody united themselves, and did the work that we were supposed to do. And we were also very grateful. The community was very grateful in the work that we're doing, helping our patients and families, and really supported us by sending us food and drinks and masks and things, to just support us. And even though we were all fearful, we all came into work and kind of worked together. And it really taught me at that point that, what life is all about, certainly as a doctor, is just number one, take care of our patients. Number two, take care of ourselves. And number three, take care of each other. That's it. Everything else is secondary. And a lot of things that you're doing, Sophia, what you mentioned is exactly doing that, right? Helping ourselves, helping each other, helping our community. So on March 25th, I had done a podcast with my colleagues, Doctors Eric Widera and Alex Smith. They're in San Francisco at UCSF, because at that point it was really only New York that was hard hit in the US. So I did a podcast with them about what's it like working in the front lines. So in the hopes to prepare other states and other colleagues about what to expect in case the coronavirus hit other places. Since then, it has pretty much happened in all states in the USA. And then on the 26th, I'll never forget that day. Actually, 2 days ago, it was my 1 year anniversary of being sick with COVID. In the morning, I went to work. I felt okay, maybe like a little allergy or something. And then by about noontime, I just suddenly had chills and I was very weak. And I sat down in my chair and I couldn't even get up. So I said, oh my God, don't tell me I have COVID. I managed to get an appointment to test myself. And then I drove back to home and I basically started quarantining myself. And it was a big shock for me because I was healthy. I don't have high blood pressure, diabetes, or any other medical problems, just like seasonal allergies. But I became pretty sick after I go home and quarantine myself. I slept for 3 days straight. I couldn't even wake up. And then on day 4, I felt better, and I said, "Oh, maybe it's over. Maybe I can go back to work now. Just rest a couple more days." And the next day, boom! I had fever. I had severe headaches, cough. I was back to bed. I had what I was called COVID brain, in that I really couldn't think straight. So I told the hospital that they shouldn't call me anymore because I wasn't able to make any good decisions. My children still remember that when I had very bad headaches, I would kind of just hold my head and scream. They still remember that. I think they're traumatized from that. And for a couple of nights, my oxygen saturation, I had an oxygen oximeter, and it dropped to about 92%, which for a healthy person, it's becoming low. And I was thinking, maybe this is it, maybe that's it for me. And what if, this is the end of me? What regrets would I have? What are my children going to do? What about my husband and my parents and my family? Like, what's going to happen to them? And I basically decided that if I died at that point, I didn't really have any regrets. We had traveled and I have a beautiful family and I've done a lot of really wonderful work. My work is like my second family, and no regrets. I had to think about my advance directives. What are my wishes if I got sicker? And that's when I realized me and my husband, that's my husband, he's a ER doctor, and we had very different wishes. My wish is that if my COVID-19 got worse, I wanted to stay home. I didn't want to go to the hospital because the hospital was overrun with COVID patients. There were no definitive treatments at that point. Um, and people who end up getting intubated being on artificial support with the machines, vast majority died, 70-80% death rate. So I was like, I don't want that. I just want to stay home, get home oxygen if I needed to, and tough it out. And my husband said I was crazy. He said, forget about it. If I get COVID-19, I want to go to the closest hospital. You can put me on a machine, intubate me, do whatever. Make sure the hospital has a remdesivir trial so I can get on it and do whatever you have to do, and we'll go from there. So even though we've been married for a long time, our views were completely different. Our advance directives were completely different. So it's very important, even within families, to discuss things, because no two people are alike. So advanced directives in Chinese is 预前事前指示，每一个人的观点都不一样，所以就算大家住在一起，还是应该互相就讨论。要是万一真的就是病情严重的话，应该怎么做？因为每一个人的意见都不是一样的，要尊重个人的意见。So how do we really deal with our family relationships? We've been infected with COVID. I really feel like palliative care taught me a lot because I was seeing patients, I'm used to seeing patients who are seriously ill. And COVID was definitely right in front of us, COVID patients who became seriously ill. And I had a lot of colleagues, the ones who are in medicine or in surgery or in emergency medicine, they actually are not used to it. And so they would come to me and my colleagues and say, hey, how do we talk to them about their advanced directives? How do we talk to them about what if they're not going to get better because we don't think they're going to get better? And how do we try to like get their families and say goodbye and things like that? So we were really trying to disseminate a lot of the information that we have to our colleagues. So palliative care is basically care for patients who face serious illnesses. It should be translated into 缓和治疗、缓和医疗。但是现在假使你们去 Google 它的 translation 的话，你们最可能找到的就是姑息治疗。我不喜欢姑息治疗这个翻译，因为好像就是说什么都不要做，就把他们放在那里那样。So that's no good. So I'm actually working with Language Line, the translation company, to try to change the translation so that we don't scare patients or we don't scare our colleagues. But palliative care is all about symptom management and providing an extra layer of support, effective communication, etc. So I'm using the palliative care ABCs to help me and my family cope with COVID-19. So what are the ABCs, right? A is for acknowledging, accepting. B is for breathing and basics. Basics are important. That's why they're the basics, right? A lot of times we start using more advanced things or think about advanced things and we forget the basics. Like we want to do all these things and we don't get enough sleep. Well, that's not good because you need enough sleep in order to do all the other things. C is courage, building connections, having a community and compassion. So I'll talk a little bit more about each of those. So acknowledging is acknowledging that we have emotions, all the emotions. I put up an emotion wheel that I got from the Greater New York Hospital Association. They actually ran a series of webinars about well-being and coping in the times of COVID. But you know, if our children get angry or if they get anxious or they get scared, just say, I can see that you're angry. I can see that you're scared. I can see that you're upset because of school and you can't see your friend. Or just name the emotions. It's very important. We should not sweep them under the rug, okay, and pretend they don't exist. We can just name them. We should also name the pain and suffering that we're going through because we are all going through it. We don't have normal lives, okay? But then accept the reality. Don't say, oh, I wish COVID weren't here. I wish I could go back to normal. Well, nobody's going back to normal anytime soon, right? I just read an article that even if all of the USA is vaccinated, we still will not have herd immunity until the whole world is vaccinated because people travel all around. So this is not going to be over anytime soon. And the more we accept that reality, the better. Otherwise, we can get very upset. Okay. There's a very good quote that I learned from a friend of mine who practices Zen Buddhism. And Buddha has a quote that says about pain and suffering, that pain is inevitable. It will happen in life, but suffering is optional, right? So what does that mean, right? It's like two arrows. The first arrow is the pain, like COVID hit and people got sick and school shut down and we can't go back. That was not something we can control. But suffering is the second arrow, is how we cope with it. So if we let it, you know, be the second wave of pain and say, oh, I hate this, I can't go back to school, and I'm just going to be mad and upset all the time and just wish things would be better, that's going to cause us suffering, right? So, but if we have a different mentality and say, wow, this happened, I'm still alive, my family's still here with me, maybe we don't have, you know, normal school or normal social interactions right now, but I'm going to take advantage of it because actually I can stay home and cook more. You know, usually I don't have time to cook, and now I have more time to cook. Just small things. and just reframe our thinking. And that helps a lot. So, because suffering is optional. Okay. So, talking about bees, a big thing that I learned about is breathing, because when I was sick with COVID, I had difficulty breathing. And I usually take breathing for granted. You know, we all breathe. When a baby is born, the doctors in the labor and delivery actually say, you know, what's the breathing score, right? And then when we die, the doctors come and say, okay, they stop breathing. So breathing marks birth and death, but in between, we actually don't think about it. Well, when you're sick and you can't breathe, you can think about it a lot. So I want everybody to just maybe take a moment who's watching and kind of, we can do a couple of cycles of the breathing. This is called boxed breathing. So basically you breathe in and hold for 4 seconds, and then you breathe out for 4 seconds and hold for 4 seconds, kind of like that. So we can just do maybe 2 cycles, all of us, okay? So breathe in for 1, 2, 3, 4, hold, 2, 3, 4, breathe out, 2, 3, 4, hold, 2, 3, 4, and one more time, breathe, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, hold, 2, 3, 4. So whenever we are upset or anxious or whatever, we can do like 3 breaths like that, and it can be very helpful to keep us stay calm. The other B basics are get enough sleep. We all need different numbers of hours. So you know what your numbers that you need. Make sure you get it. Make sure that we're eating nutritious food and small amounts, not too much, and getting adequate exercise, the basics. Okay, these are very important. I get up every morning and I go on YouTube and I do like 8 minutes of Zumba. I don't do more because I don't have time for more, but that's just right to like get me started. And then C is for having courage to face reality and all the demands and the stresses that we have, from making connections on settings like this with the East Meets West, having our community. And then compassion, usually people think of compassion for other people, which is nice. But the very first person that we should have compassion for is ourselves. And especially us as Asian parents, sometimes we're busy doing for other people and we don't think of ourselves. So we have to think about traveling when we're on the airplane. They always say, put your oxygen mask on first, and then you help other people, right? So the first principle of well-being is put your oxygen on first. Now we have to have compassion for ourselves first, otherwise we're not going to be good for other people. So I feel like definitely being sick with COVID, I learned a lot. I feel like having the symptoms made me a better doctor when I went back to see patients. I appreciate life so much more. Like today was raining. Usually if it's raining, I would be complaining, oh my God, it's raining, there's no sun. I'm like, wow, rain, this is great. The plants need rain, and it's really nice for the planet, and rain makes me happy. So it's just wonderful. If it's a sunny day, I'm like, sun makes me happy, okay? Just appreciate everything, and a better parent. So at this point, I wanted to see if CJ, maybe you can start talking about like how COVID affected you during that time.
Sure, of course. Thank you for having me here. I mean, yeah, sure, I can totally talk about it. So the first day I remember about COVID was March the 12th last year. I was sitting in school, it was third period. I remember which class I was in. I was in health class. And we had just got an email that school would be closed that Friday for a school meeting. And we were like, oh yeah, that's awesome. Oh, cool, we got a day off. So, and then the day after, my SAT actually got canceled. I was supposed to take it on March the 14th. That got canceled. I was like, oh, okay. So it's getting real, huh? But at first I didn't believe it. And then that Sunday, my cousins came over. They actually stayed overnight at our house. And the next day, that Sunday, we got an email that all schools in the tri-state area would be closed, and that we were switching to fully remote learning. And as time went on, it got more and more real, and I started to believe it more and more. But I still didn't believe it. And then March 26th was when my mother got sick. I was sitting outside with my dad. It was a very sunny day, and it was actually quite hot. Much like the weather we had earlier this week, it was very similar to that. And we were just sitting outside. My dad was playing guitar. I was learning a song from him. And my mom pulled in the driveway, and she seemed off. And so I went to give her a hug, but then my dad pulled me back and said, no, she's sick. And that's when I realized that, oh my God, my mother has COVID. This just got real. And the next month was difficult to say the least, but we did manage to push through, thank God. I remember one day, I remember the second day, my mom got a spoonful of comfort soup delivered to her, and we actually delivered the soup to her from outside the door because we couldn't actually go inside the room. And there was also another day I went inside her room to vacuum the floor, and I was like, wait, what am I supposed to wear? I mean, I can't vacuum like this, otherwise I'm gonna get sick. So in my basement, there was a kid's style bunny suit or whatever it was with the goggles and everything. I was like, you know what? I'm gonna wear that and vacuum her floor. I did that, and she was very happy that I did it. So yeah, but I mean, for the most part, that month was rough. And then once she recovered, that's when I realized, wow, we just got through this. And even though it's still going now, I know what to feel and what not to feel now. You know, it's basically the norm at this point. It's a new normal for us. Well, not really new anymore, but it's more of just of a normal at this point for us. Yeah.
Thank you, CJ. Thank you. Chris?
Okay, so in my perspective, my brother went over a lot of this, so I guess I'm going to be a little bit more specific. So in terms of my school life, when we were cut short on that year, it was definitely hard, just because, especially for me, just because a lot of my friends at that point were seniors, because I am in a school choir where I had made a lot of friends. So the school year being cut off basically prevented me from actually seeing them before they went off to college. So that was definitely tough. But I guess a bright spot in it was that we didn't have many final examinations. No math finals, just basically no real standardized testing. So it was definitely easier to get through than other years in terms of how much I had to work. At least at school, not really at home, because I would say that once my mom got sick, me and my brother, both got far more mature in terms of housework and just generally as people. Just as examples, when she got sick, we used to have a housekeeper who left, so we both had to take up chores in addition, and it was possible just because school had also been released at this point, so we could dedicate ourselves more to the chores. We both learned a lot, both worked harder, and as a result, we had our house clean, and we could do that pretty regularly. Now that we have school, it's a little bit tougher to balance everything, but it works out.
Thank you so much. I'm very proud of you guys. I'm gonna keep going. So finally, April 27th, I returned to work. When I went to the outside of the hospital, I just felt very surreal and, returning there. And my rehab kind of journey was also long. I had my kids kind of go out with me after I got better from COVID. At first, I couldn't even walk outside for 1 block. I had to slowly build myself up and, get my lungs in better condition. But finally, a month later, I was able to return to work. And I started seeing patients again. And one day I got downstairs in the lobby, they called me and said, oh, can you come down? One of the patient's family sent you this. And it was a patient's family that sent me a mask with my name on it. And, it just really meant a lot to me because it was a very difficult patient situation and I was very frustrated. I didn't think I really helped them, but I guess I did. And that's a wonderful memento from those times. And I decided to just do a lot of talks with the Chinese community, including the World Journal, which is 世界日报 and AM 1380, which is a radio station for like Chinese audiences, just to let people know how important it is to wear the mask. And if they get sick, to prone, which is sleep in a prone position with the face and belly down, which really helps the lungs in people who have COVID. So anybody who gets sick, I think that's an important point to remember. So now we're gonna just switch gears a little bit to the 3 vaccines. The 3 vaccines that are mainly available in the US are the Pfizer, which is the first one here, and the Moderna, and then the J&J, which is Johnson & Johnson. It's very important to remember that the vaccines that are available in the US are different from the vaccines that are in China, which is the Sinovac, as well as the ones that are being used in Europe. I think we've all heard news about the European rollout. And the good news right now in the US is about, about a third of adults who qualify have received vaccinations at this point, which is really wonderful. So the Pfizer and Moderna vaccines are very interesting vaccines that are messenger RNA vaccines. They're really the first of their kinds. Even though they were released fairly quickly, they've been really under research and investigation for a long time. That's why they were able to be released so quickly. And that's the other silver lining or positive point about COVID is that information is just turning around so much more quickly. And things are happening, like right after the virus broke out and it came to the US, US doctors were in conversation with Wuhan doctors, like right away in real time about what to do and what to watch out for and things like that. And things that used to take a long time, like medical publications, used to take months to get approved, and now it takes hours to get approved. So everything has been sped up, and that's a really wonderful thing that hopefully we can keep even after COVID. But basically the way the messenger RNAs work with Pfizer and Moderna is that there is no viral particles in there at all. It's a messenger RNA. Anybody like, you guys teenagers who are studying biology and stuff, that is the coding for making proteins. So they are coded, it's basically the messenger RNA to tell the body cells to make the spike protein of the COVID virus. So once you get the vaccine, it tells the cells to make that spike protein, and it fools the body into thinking that they're seeing the COVID virus and starts making antibodies against it. So it's very safe because there's no virus in it. Different from the Chinese vaccine, Sinovac, which is a inactivated virus particle. So people tend to have more reactions to it. Of course, there will be some reactions once you get the vaccine, in that if you do get reactions such as it hurts in the site of the injection, that's very normal. Some people can even get some slight fever or headaches and stuff like that. That's all normal. It just means that your immune system is working and making antibodies. So the efficacy for Pfizer and Moderna are both around 94 to 95%, which is very good. The flu vaccine is only about 60%, 50, 60%. and it's meant to decrease the incidence of symptomatic COVID infections. The J&J, which is Johnson & Johnson, the efficacy is about 86% effective against severe COVID infections. The J&J is the one that's going to be more popularized because it doesn't have all those refrigeration and freezing requirements. And it's only 1 dose instead of 2 doses like Pfizer or Moderna. And this was a study that was released recently at NYP, looking at healthcare workers who were not vaccinated, who were partially vaccinated, like got 1 dose of the 2 doses, and then who were fully vaccinated, meaning they got both doses, and how many people ended up getting COVID infections. So of the many employees that NYP has, there's only part of the employees, not all of them, that employees who are not vaccinated, there were 2.6% who ended up getting COVID. If they got 1 vaccine, it went down to 1.8%. And then if they became fully vaccinated, it was very, very few, only 4 out of 8,000 plus employees who got COVID. So the vaccination definitely works. That's why I was saying, if you have an opportunity to get any of those vaccines, just take it. And the vaccines have turned out to be pretty safe, even for pregnant women and people expecting to get pregnant. So the other thing that we're going to talk a little bit about is how you handle kids going back to school. School and social connections are very healthy. They mean a lot to our kids. Here in Great Neck in New York, we've had a hybrid model, and our kids go to school every other day. So let's say day 1 is Zoom from home. Day 2 is physically in school. Day 3 is Zoom from home again, and they just alternate every day. But I would love to hear from CJ or Chris about how that's working out for you guys.
All right, so I guess I'll go first for this one too. So like my mom said, school and social connections are healthy. One of the reasons why it was much harder to get through the school year last year was because we had no sort of connection, as so to speak. Like, because the pandemic was so sudden, we had to go from fully open to fully remote, and there was no in between because there was no time to plan for what could happen. So because of that, it was very detrimental to our social lives. It was very detrimental. You know, I had a lot of friends. I had a lot of friends back then. I still have friends now, but a lot of my friends who I only hung out with in school are now fully remote. I don't really talk to them that much anymore. And COVID was one of the reasons why. Now, the hybrid model works. It's not as good as fully in person, but we can't go fully in person. If we could, that would be great. But it's getting closer and closer though. You know, I'm hopeful that this year, maybe in May, you might have a week fully in person, maybe. That would be my dream come true. But I mean, I don't think it's really gonna happen. But the hybrid model does work. So now, like, all right, so 3 W's to reduce the risk of COVID. Wear a mask. It's not difficult. It's not difficult to wear a mask. You know, I saw an image at the beginning of the school year in Georgia. There was one school that didn't wear any masks. And I'm not sure if this is true or not, but a lot of them ended up getting sick. And then number 2, wash your hands. I can't stress this enough. Especially now, it's very important to wash your hands in general, but especially now, it's even more important. And number 3, watch your distance. In the high schools, now you can do about 3 feet now, because CDC recently listened their guidance to about 3 feet. But to be safe, if your school doesn't specifically say 3 feet, try to do 6 feet still. Those are my tips for now.
Thank you, CJ. Chris?
As for me, I strongly agree that the hybrid is a model that is as good as we can get for the moment. I don't think that fully remote schooling is at all comparable, both in terms of the experience, how you work, how you study, etc. I've asked all of my teachers, and I've gotten the same answer for each and every single class. Whenever students transition from the hybrid model into fully remote, their grades basically always drop. And it could be small or significant, but it's always, that difference is always there. And of course, as both my mom and my brother have mentioned, there is these social connections that you make through school. In this day and age, a lot of people don't really keep up in person anymore. So school is one of the main places where you can see other kids that are your age and that you interact with. So when you take away that from your life, it can lead to very big detrimental effects. So essentially what I would say is that I strongly recommend hybrid. Of course, there's no forcing people. Parents, you guys have to decide for your own kids. What do you guys think? You can also leave it to the kids, but still, I would strongly recommend going hybrid for social, schooling, and all the reasons I've mentioned.
Thank you so much. And kids, teenagers, when they get COVID, everybody's at risk for getting COVID, right? Kids, when they get COVID, they don't really get that sick, not like people who are elderly or who have other comorbid conditions. But what happens is when kids get it, they can spread it to other people who may be more susceptible and get sicker. So that's why it's very important for kids to watch their distance and wear the mask and wash their hands. And hopefully the vaccine soon will be rolling out to kids as well. So just talking a little bit about long-term sequelae of COVID-19 or Pasc. I found this really great graph that shows that it's very common. At first, I didn't think that I had any long-term effects from COVID, but I think that I probably do have fatigue. I don't feel like I have the energy that I used to before COVID. I need more sleep. I definitely need to get my sleep. Otherwise, I really, really feel it. And as you can see from this graph, 58% of people who survive after COVID get fatigue. And then there are other symptoms like headache, which is pretty common. One of my coworkers at work just told me that her memory is not the same. And when she's on a Zoom meeting, sometimes she can't remember like what words she wants to say. Sometimes she can't even remember that there was a meeting, even though she was the one running the meeting. So some people have gotten pretty anxious. So one of the, I guess, the good things that came out of COVID is that well-being and burnout used to be that people don't pay too much attention to it, but now it's front and center for everybody. And the other good thing is that there's much more telehealth and telemedicine, which has made mental health and psychiatric and psychological services much more available than before COVID, which are good things. And as you can also see, all different organ systems in the body can be affected as part of a sequelae from COVID. And in terms of just psychiatric symptoms, 1 in 5 COVID-19 patients who survive actually had received a psychiatric diagnosis within 90 days of their COVID diagnosis. Most commonly, anxiety, depression, PTSD, which is post-traumatic stress, insomnia, and dementia. So it's a scary thing, but it's important to know that they do exist. It's not a weakness, and it's very important to get help. And the other reminder I wanted to make is that we are actually coping with 3 pandemics, if not more. Okay, COVID is one that everybody knows, but the mental health and the burnout pandemic has been there because we all lead very stressful lives. And then there's the racism pandemic. It started with BLM, Black Lives Matter, and now there's a lot of anti-Asian hate crimes and racism, which myself as well as my kids had experienced and witnessed, and we talk about it. And it's very important to speak up. And last week, I actually helped our hospital organize a rally to have a moment of silence for the Atlanta shooting victims and to raise awareness about anti-Asian racism and it's not okay. Okay, we have to speak up for ourselves and for other people, so that nobody is tolerating injustice. One graph I wanted to share with everyone is called Maslow's hierarchy of needs. So it just talks about that there are different levels of needs that we all have, starting from the bottom, which is the foundation, or the basic needs, which is food, water, warmth, and rest, right? Things that we need to take care of our bodies and our environment, having security and safety. If those basic needs are not met, then we don't really care so much more about the other needs. The psychological needs are the next ones, which talk about having, intimate relationships and friends, prestige and meaning from work. And then at the top is self-fulfillment, which is achieving our own life's purposes and full potential. But if we don't have the basics like food and water and security, then it's not useful to talk about the others. And that's the hierarchy that makes a lot of sense to me, definitely for our residents in the hospital who are training, becoming future physicians. And then this is a resiliency tree that I got from one of my Columbia colleagues, Anna Allman, which is wonderful. I feel like each day, if we can pick maybe one leaf or one branch to practice for real, whether it's engaging in self-care or having hope or cultivating gratitude, something, if we can look at this tree every day and say, today I'm going to pick one thing from the tree and really practice that, that would be very, very helpful, or maybe create a community around that. And then to finish, I want to share the 4 things that matter most, which is from a book that Ira Byock wrote. He's a palliative care physician. And he wrote a book outlining stories that he experienced as a palliative care doctor, and the 4 things that really ultimately at the end of life matter the most, which is being able to say, forgive me, and I forgive you, and thank you, and I love you. The 4 things that matter most. And with that, finish with my talk. And I guess we can go to questions and answers.
Thank you so much, Dr. Pan. And Isaac, please take it away. You got some questions already.
Yes, Dr. Pan. I have 2 questions related to the vaccine. So the first question states that my husband is a medical professional at Kaiser and got fully vaccinated. However, he still got tested positive after the vaccine. Was this very unusual? Did the CDC guidelines say that we don't get coronavirus infection after fully vaccinations?
Wow. Yeah. So with COVID, what happens is that a lot of times the answers to hard questions like this is nobody knows, because we're really at the beginning still. You saw from the graphs that I show that people who do get vaccinated and fully vaccinated have a lot less infections, and definitely a lot less severe infections. But is it 100%? No, right? So maybe your husband was the unlucky one. But I'm also curious when he got the infection, what the timing was, or maybe he got it before he was fully vaccinated. And also, did he get a very severe infection or not too severe?
Thank you. And the other question looks like it's also a couple. Both of husband and wife are medical doctors. And then they have a 17-year-old boy, got the second dose, who's been experiencing a huge headache. They took him to the hospital and reported to the CDC, and they're wondering if CDC should not advise teenagers to be vaccinated.
Wow, that's very interesting. Do they say which vaccine her son got?
No, not stated.
Yeah. That seems to be rare, and the studies have not been studying teenagers so much. I think just now they are doing one, looking at teenagers more in the responses. But definitely, I feel like they're doing the right thing in reporting it to the CDC, so the CDC can just amass more data about different populations.
Mm,
That's unfortunate, though.
yeah.
That's scary.
We have a third question just came in. It's quite interesting. That 2 years ago, that well, the attendant this question, the person um, found out that they failed the dental implantation, so they need to have the implantation removed. But the person is very concerned whether this is going to be a good time to do that, whether the excuse me, vaccination would affect the operation and the recovery. So he's asking, should I do this after the vaccination or not?
So did they say that they had the vaccination or they did not have the vaccination?
Um, they already had the vaccination, so looks like the question is whether at this point is it safe um, to do the operations.
Sorry, a quick interrupt. Actually, the Chinese itself is asking, I am waiting for the vaccination, but should I
Oh.
wait for my vaccination first before I go to do my dental procedure, or should I take care of my dental procedure now before the vaccination? Is the original Chinese. Sorry.
Yeah, that's a very difficult question to answer. I guess my question would be, are they really on the list to get vaccinated? Is it going to happen soon or not? If it's just something that the vaccination, they have to wait a long time, then maybe it's just good to take care of it now. Because I know I personally had like a dental implant in the past, and before that happened, it was very, very painful. So if there's a lot of pain and symptoms and it's an urgent situation, maybe it's good to just take care of it. A lot of, this now we're in the second wave, second surge in the hospital, and the procedures are happening. Everybody is following very safe kind of routines to minimize any kind of infection. So surgeries are happening, procedures are happening, both dental, podiatric, things like that. So as long as the dental office has safety procedures and you feel comfortable with them, it's probably okay to just take care of it.
Okay, last question on the vaccination. When can we expect children 12 and under to get the vaccines?
Nobody knows. They're the least, I guess, high risk group, which is good. That's why even after vaccinating, we still have to follow the same rules. Some people think after they get vaccinated, now they don't have to wear a mask, they can go out, they don't need to social distance. It's not true. Okay, they still have to do all the same procedures, especially with the previous person who raised the question that somebody got vaccinated and then got the infection anyway. So it's not a guarantee. It definitely can reduce the risk for COVID infection, as well as severity, that even if you get the COVID infection, it won't be so bad, but it doesn't mean that it's complete protection.
Okay, and I've got a couple of questions regarding distance learnings. The first one, after a year long distance learning at home, my boy has been so addicted to computer games. How should we emphasize on less screen time at home while sustaining a healthy family relationship in consideration of mental health management for our children?
Yeah, that's a tough one, right? Even I feel like even before COVID, kids were already like leaning in that direction, a lot of times using their devices. And now with COVID, it may be even more so because they're not going to school as much, um, or people rely on their devices to maintain social connections with their friends. But if it's only like playing games, maybe that's a situation where there could be like a family meeting, right? To everybody talk about this as an issue. Nobody has the solution, right? Kids don't necessarily want to be told what to do nowadays, right? Chinese parents tend to tell kids what to do, and kids who are Americanized don't necessarily want to be told what to do. Uh, so I'm struggling actually with one of my residents right now, who's having a conflict with her father because her father wants to tell her what to do. And if she doesn't do it, the father feels like she's not respecting him. But she says that, oh, I'm raised American, I'm supposed to think independently, I don't have to do everything that my father wants to do. So they're getting into a big conflict. So the best thing probably is to say we're going to organize a family meeting to discuss a very important topic, so that we can hear all sides, right? Just listen. Our kids have very good, very good points. We have to make sure we listen to them and see what they have to say and then come up with a solution together. I don't know if my kids want to say anything about that. They use the devices a lot too.
Um, I don't really have anything to add. I think you really kind of captured the essence of the answer pretty well. So I think we can move on to the next question, unless you have more to add.
Okay, thanks.
Well, it's a second one is sort of related. How do you motivate your teenagers to follow stay-at-home order, keep social distance, and as well as the distance learning? It is so hard to manage the young adults.
Yeah. So in terms of social distancing, we do that. In terms of stay at home, I don't know if you guys, do you still have a stay at home order in California where you are or no?
I don't think
No,
so.
no,
No?
not
Okay.
anymore.
Yeah.
Mhm.
You
We're in
haven't
the red
had
zone.
it, when was it lifted?
We're in the red zone now in the LA County, Orange County areas. So it's limited opening with, of course, indoors at 25% occupancy, but no longer stay at home order. It's been about a month and a half.
Okay. Yeah. So the stay-at-home order in New York, even when we had it, it was like not to go to crowded places. But if you wanted to go out for a walk in nature where you're really pretty spread apart from anybody else, that was not a problem. So maybe this is the time to gather the family instead of watching the device to say we're gonna go for a walk, or we're gonna go have a trek, or we're gonna go someplace where it's spread out, just by the nature of it and have a little more family time. Let's face it, kids are going to grow up and then they're going to leave. So if we don't maximize this time now, when are we going to do it, right? After they leave the nest, we're not going to really see them as much. So this is the time to just spend a little more time together.
Thank you. So those were the questions. We do have a comment about herd immunity as well. I know you mentioned that in the very beginning. Can you just share with us a little bit more about herd immunity, and can we ever get there?
Generally, what they define as herd immunity is if more than 70 or 80% of the population has been immunized. So I think right now what I'm hearing is about, I'd say about a third. So we're not really there. Personally, in New York, I'm not happy with the rollout. It's been very difficult with getting vaccines. Even places that say they're supposed to have vaccines, when you go online and check, they don't have it. Or you make an appointment and they cancel. We've heard a lot of complaints about it. So I feel like with the vaccinations rollout, we have to do better. But, it's a federal mandate, and I think the goal is to make sure everybody's vaccinated. The problem is that we don't live in one country anymore. There's so much traveling that the world has become a very small place. So if we travel to, you've heard of different variants already, right? It's the UK variant, it's the South Africa variant. Now there's a New York variant. So because of all this, we're one big global community, and that's why when we talk about herd immunity, we're talking really about a global community. Does that mean that we're not going to travel? No, right? It just depends on how much risk are you going to take and what precautions you're going to take. So we were afraid to travel for a long time, but next week we are going to travel. We're going to go to Colorado and we're going to go skiing because we're not going to put life on hold.
Yeah.
Are we going to be
Yes.
careful? Yes, right? We're going to stay 6 feet apart, from other people that we don't know. And hopefully the ski places, I think they're pretty good about distancing people. And skiing is one of those things where you can stay distant. So we just have to choose activities where it's feasible.
Thank you so much. So all of our questions and answers have been addressed and perfectly timed. And Dr. Pan, you are always so perfect when it comes to the time management side. So I know at home, your children, I'm sure, have you as an excellent model in that regard as well. So, oh, wait. We'll talk after the meeting here. Anyway, thank you so much. I hope those of you that are in the San Marino area and the surrounding communities, you will join us next week, Saturday, 9 a.m. to 12 noon. Again, go on Google, San Marino Egg Hunt. It'll be a fun drive-through experience. East meets West was requested by the city to participate. They only wanted certain really, vital community organizations to be part of this very safe and fun environment. So hope to see those of you that can come at that time. 下个礼拜六哦，我们到时候很好玩的9点到12点，只要您的小孩是2岁到12岁的，圣马力诺这个城市呢，他们市政府特别与我们美洲家长亲子教育协会联系，希望我们给大家一个很好玩的机会，所以呢，希望到时候见。您就是到 Google 上面去打 San Marino Egg Hunt 就可以知道所有的细节了。好，谢谢。Thank you, Dr. Pan. Thank you, Christopher. Thank you, CJ. You guys have been amazing with all your input. Thank you so much. Yay.
Thanks for having us.
Thank you.
Thank you. Alrighty. Bye-bye, everyone.
Bye-bye.
Thank you, Annie, for all the organization. Thank
Thank you, everybody. Have a good
Okay.
afternoon and evening in New York. Bye-bye.
Bye-bye.
Bye.
Bye-bye.